Next is hydronephrosis. It is a complication of renal stones. So we will see what are the complications which are affecting the kidneys. It is the aseptic dilatation of the kidney caused by obstruction. Hydronephrosis is the aseptic dilatation of the kidney caused by obstruction. That means there is no infection. The dilatation is because of the obstruction and there is no infection. Then again, there may be unilateral hydronephrosis or there may be bilateral hydronephrosis. What are the causes of unilateral hydronephrosis? Unilateral hydronephrosis cause may be, number one is extramural obstruction. That is the obstruction from outside. It includes tumor from adjacent structures such as cervix, prostate, rectum, colon and cecum, or idiopathic retroperitoneal fibrosis or retrocaval ureter. Number two is intramural obstruction. Intramural obstruction means the obstruction is from within the pelvic ureteric area. So it includes congenital stenosis, physiological narrowing of the pelvic-ureteric junction, congenital small ureteric orifice, inflammatory structures following removal of the ureteric stones, rupture of the damaged stricture, a tuberculous stricture or neoplasm of the ureter or the bladder involving ureteric orifice. So these are from within the structures, kidney, ureter, bladder structures. Number three is intraluminal obstruction. Calculus in the pelvis or in the ureter that is still present in the pelvis of the kidney or the ureter, or sloughed papillary necrosis as in case of diabetes, sickle cell anemia, analgesic abuse. So these are all the causes of unilateral hydronephrosis. Then bilateral hydronephrosis. What are the causes of bilateral hydronephrosis? It is result of urethral obstruction or lesion described above are present in both ureters, right or left, not single but both the ureters. If both the ureters are having same obstructive pathologies, then it is bilateral hydronephrosis. Congenital includes post-urethral valves or urethral atresia, and acquired may include BPH, benign prostatic hypertrophy, carcinoma of prostate, post-operative bladder neck obstruction, urethral stricture, etc. etc. Then the clinical features. Unilateral hydronephrosis. Most common cause is obstruction of the pelvic-ureteric junction, and that is by calculus. It is more in women and on the right side. There may be mild pain or dull ache in the loins. On examination, there is palpable kidney and it shows intermittent hydronephrosis or Dietl's crisis. What is Dietl's crisis? Dietl's crisis is when the loin is examined with acute renal pain, there is a swelling, and as the pain goes, the swelling also goes or disappears, and with it there is large volumes of urine which are passed by the patient. That means there is hydronephrosis, there is pain, and it is palpable. And when the patient passes large volumes of urine, the pain also goes, and the swelling also. This is called the intermittent hydronephrosis. Hydronephrosis, fetal life. In case of fetal life, if hydronephrosis is seen in antenatal ultrasound, the cases are benign and need postnatal investigation for follow-up. Whereas in bilateral hydronephrosis, from lower urinary tract obstruction, symptoms of bladder outflow obstruction predominate. The kidneys are impalpable because of renal failure. From bilateral upper urinary tract obstruction, when both ureters are affected by fibrosis, symptoms may be unilateral or bilateral. Or from pregnancy, dilatation of the ureters and renal pelvis occurs in early pregnancy up to 20th week, caused by circulating progesterone. The ureter return to normal within 12 weeks of the delivery. This is increased liability to infection. There is increased liability to infection. So it is a normal percent in case of pregnancy because of progesterone. Investigation, ultrasound scan, it is shown as dilatation of the pelvic-ureteric junction or pelvic of the kidneys. Intravenous urogram, it shows function of the kidney and obstruction in pelvic-ureteric junction and dilatation of the ureter above the obstruction. That means because of the stone or anything, when it is present within the ureter, there is dilatation above the obstruction, whereas below the obstruction it is normal. Normal cupping of the calyx lost and clubbing starts. Because of this obstruction, the urine accumulates and it causes the loss of calyx cupping, and it develops into full moon like clubbing. Isotope renography is best test to confirm obstruction of the dilatation of collecting system. Treatment is operation, surgical, Anderson-Hines operation, pyeloplasty, or endoscopic pyeloplastis. Endoscopic balloon is passed in the ureter to break the obstructions, fibrosis. Partial nephrectomy, number 3, for kidney having 20% functions, and total nephrectomy for non-functioning kidneys. Reference is Short Textbook of Surgery by Bailey and Dove, 26th edition. Thank you. These are the complications of kidney stones. Next is pyonephrosis. So we would continue with it.